I mentioned a moment ago, now we visit with Dr. Rodney Rohde from down, not too far from here, Texas State University in San Marcos. And if you've been a listener to the show for any period of time, you know that Dr. Rohde has kind of evolved, become our public health expert here on the show. He's a chair, professor, research dean, keynote speaker, author, you name it. Dr. Rohde has his hands in it. And Dr. Rohde, we appreciate you returning to the show. I wish, of course, it was under better circumstances. Let's start with this on a personal note. You are a Texan, so to see what's gone on due to Hurricane Harvey over the course of the past 4 or 5 days, what has that done to you emotionally?
It's been pretty interesting, as we've talked about prior to this interview, just in the stance of I have some family and friends. I grew up in Smithville in the LaGrange area, so even in those areas it's catching, a foot or more of rain. So that's been a concern and a worry, just kind of making sure family and friends are okay. And then I have so many colleagues and friends that are in the Houston area and along the Gulf Coast in programs like the Clinical Lab Science program at Texas State. So we're really seeing that displacement and that kind of things that are going to come even weeks to months after this, and kind of realizing how bad of an event this is.
Yeah, and you bring up a good point, and as you're kind of wrapping up this episode in terms of our guests, as we've visited with the Red Cross, as we've spoken for the guys who are out there saving lives, a lot of it's been focused and centered on Houston, but you bring up a good point. Maybe because of the national media coverage, we lose sight of the fact that Hurricane Harvey came through Rockport, which is many miles away from Houston/Harris County. And you mentioned Smithville and LaGrange. Those two towns are about an hour due east of Austin, and then you go another hour and a half before you reach Houston. So the scope of what's happened here in the state of Texas goes well beyond the borders of Houston.
It really does. And we were talking this morning, our faculty, we started today at Texas State, and we have so many Houstonians and other Central Texas students that come to the university that are being affected by this and have real concerns, worrying about family and friends like that. But yeah, we certainly can't forget a lot of these small rural towns that lead into Houston, whether you're coming from the coast and heading kind of northeast or even in the surrounding area. It's just, bizarre. I live in Kyle near San Marcos, and going to San Antonio on Sunday to visit my son who's starting school there, it was barely raining, 2 to 3 inches, whereas in the Kyle, Austin, San Marcos area, it was more like 7 to 10 inches. So I can only imagine what a foot or 2 foot of rain is doing in those kind of low-lying areas along the Colorado River and elsewhere.
As you've visited with us over the course of the past couple of years, Dr. Rohde, oftentimes, and I'm going to add the word unfortunately, when we've been talking about public health, it's been because we've noticed how too many times, oftentimes, we, the government, organizations, are reactionary rather than being proactive. Hot off the presses, I have it right in front of me. Here on LinkedIn, you penned an article, "Why do we wait for a natural disaster to do what's right?" Give us an overview on this piece, and I encourage everyone to go to Dr. Rohde's LinkedIn and read it in its entirety, but kind of give us the key points of your argument.
And I do appreciate the shout out to the article. I think the article, which I wrote yesterday, in all honesty, was just a story of kind of trying to release some frustration around this event in regards to preparation about public health. And so it's not just, as you know, my slant is always about infectious disease and things like that can occur around not being prepared, but also more critical things like just clean drinking water and displacement of people and pets and any number of issues that can come around not being prepared. So when I sat down and wrote this article yesterday, I kind of tapped into some of that frustration. And let me start by saying I am in awe and very honored to represent public health in Texas and across the country. These people go to work every day. Rarely do we think about them until there is a disaster or some disease that's, an outbreak coming through our state or our nation. But know that these people are showing up every day. and doing their job well, usually with very limited funds. And so this is not an effort for me to try to criticize the coastal, cities or Houston or anybody else. This is trying to help for future events. And as you know, I've talked about this on the show. This is kind of an ongoing soapbox for me about, as a nation and really globally, we need to start understanding that we need ongoing, and I talk about this all the time, eternal, dedicated, consistent, even line item congressional support for public health. We are just working with shoestring resources, and it's stuff people do not always think about. It's one thing to pile in, as you're seeing right now. I mean, I applaud the Red Cross and the private and public institutions that are stepping up all over the country to help Texas. This is what we do in America. But what's frustrating is sometimes, as you know, that will die down. And then we're right back where we started. So we don't have the type of funding to prepare and have depots of resources. And even more importantly and more difficult to do on a moment's notice is the personnel expertise. I mean, you need people that have lived through these types of events. We need to be hiring and building educational programs and building better salaries around public health and the medical laboratory, as well as all of healthcare, so that people are seasoned veterans that can step up and be leaders in these types of events, instead of throwing someone into the fire that may only be a recent graduate, for instance, or a local public official that's really not been briefed on these types of events. So it's really complex, and I'm screaming this all the way to the level of the federal government as well as local and state funding. I'm like most Texans. I don't want to be taxed out of my paycheck every day, but I just think public health and education are two things that are just no-brainers, and we just cannot keep operating the way we're operating.
The days ahead, the weeks ahead, the months ahead, Dr. Rohde, all I can do from a personal perspective is think back to Katrina.
Right.
And I was on the ground in New Orleans in that area because it was 45 days post-storm. And there were medical healthcare facilities, of course, that were destroyed. There were healthcare professionals, doctors, nurses, technicians displaced. Many moved out of the New Orleans area, never to return.
That's right.
So there are those realities, resources, physical and human. What about, in your history, your research, your study, what kind of public health issues could unfortunately come to light in the coming weeks and months that people need to be aware of? And as you mentioned, it's too late to be proactive, but if at least early on action can be taken, what needs to be done now?
First and foremost is going to be water, drinking water, and then the use of water. As you know, during these events, and if you remember Katrina, and in a way, Houston's a little bit like it in the sense that there's a lot of low-lying areas, so there's just massive issues with the infrastructure for public water, and so that's going to be critical. That's really probably the first thing that the state and local areas are going to be worried about, is that two things. One is making sure people get clean drinking water, and then the second is just roaming around and trying to do cleanup, and on your own, maybe not thinking that you're in, for instance, raw sewage that's being overrun from all the flooding. So one thing that many people may not realize, but they probably know at some level, that that's not a good thing to do, but it's because there's all sorts of pathogens like cholera and cryptosporidium and hepatitis A and a variety of microbial dangers that can be lurking in those waters. So, to go into that type of cleanup mode without the proper clothing and protection, making sure you don't have open cuts and, things like that when you're working in that type of water is really important, because you want to be careful that you're also not adding to the medical load by contributing to a waterborne epidemic in a particular county. The other thing that kind of follows up after that is what's coming in the weeks and months ahead. Even though we're entering the fall season, it's warm enough in Texas and it's subtropical enough, as you know, right up until Thanksgiving sometimes, that mosquitoes are going to, fall in love with the Houston area even more than they normally do. because there's going to be plenty of water now available for mosquitoes to breed, mosquitoes that transmit things you've heard of and we've talked about on this show before, like Zika virus and West Nile virus and other mosquito-borne viruses are going to be, if not epidemic, there's certainly going to be the opportunity. We have to be prepared that we might have an uptick in illnesses that normally are dropping in the fall. We could certainly see some problems as we approach late fall. And then even, an oldie but goodie, things like tetanus. So if people aren't up to date on tetanus vaccines, they might want to consider that, because if you're out working and doing cleanup, as you know happens, you may have had some experience after Katrina. I know as my church went out and did some things like that as well. And if you get cuts and tears or punctures in these types of places where farmland has been stirred up, that's where tetanus bacterial spores live and breed, and that gets mixed in with city water and elsewhere. It's just going to become a reservoir for danger. Not trying to be alarmist, but again, just kind of being educated and understanding that you can't be always that person, as my father used to be, just going at it. I don't have time to get sick. I don't have time to worry about cuts and scrapes. Actually can be very dangerous in these types of surroundings.
That's why we've invited you on to help educate, help get the word out, because all of the points that you brought up are entirely valid. Just because the rain stops, just because the storm moves on, right, just because the water recedes, just because you look at a structure and you say, okay, that needs to be rebuilt, there are many, many other issues to be addressed as well. So the article, again, encourage you to check this out. We'll include the link into the description of the podcast. Why do we wait for a natural disaster to do what's right? Dr. Rohde, thank you so much for joining us.
Thank you so much. As always, I love being a guest on the show, and let me know if I can help in the days and months to come.
Will do. Thank you.